Hello, my name is Omar Awan, and I'm an associate professor of radiology at the University of Maryland School of Medicine. Today I'd like to talk about a lecture on imaging of common acetabular fractures. This is a topic that I feel a lot of residents and even fellows struggle with in making a specific diagnosis on acetabular fractures, so hopefully I can elucidate that and relieve some anxiety when you experience complex acetabular fractures in the setting of trauma. So I'd like to first start my lectures out by posing a couple questions, and we'll come back to these exact same questions at the end of the lecture. And I just want you to think about these questions. So question one is disruption of the ilioischial line indicates a fracture of what? Is it the anterior wall, the posterior wall, the anterior column, or the posterior column? That's question one. Question two is based on this CT image through the pelvis at the level of the hip joints. There's an obvious abnormality about the right hip. And the question for this CT image is, what type of fracture is this? Is this an anterior acetabular wall fracture, a posterior acetabular wall fracture, an anterior column acetabular fracture, or a posterior column acetabular fracture? Question three is, the primary distinguishing feature between a both column type fracture and a T-shaped fracture is what? Is it extension into the iliac wing for a both column fracture, disruption of the obturator ring, disruption of both iliopectineal and ilioischial lines, or involvement of the posterior wall? That's question three. Question four is based on this CT image at the level of the hips at the acetabular roof. Okay, there's an obvious abnormality about the left hip. And the question here is, what type of fracture is this? Is this an anterior wall fracture, a transverse type fracture, a column type fracture, a T-shaped fracture, or none of the above? And the final question I'd like to pose before we start is that a fracture in the sagittal oblique plane on a CT is indicative of what type of fracture? Anterior wall, transverse wall, column type, all of the above, or none of the above. Okay, so what I hope to do today is discuss and understand basic acetabular anatomy. We're going to review the most important parts of the acetabular anatomy to understand acetabular fractures. Identify the 5 most common type of acetabular fractures that you're likely to encounter in your practice. Develop an algorithm for classifying those 5 common acetabular fractures, and then differentiate these 5 acetabular fractures based on imaging characteristics. Okay, so first and foremost, I think it's important to understand the anatomy, and we turn to plain films to discuss the anatomy because it's just so important to understand what we're talking about. So this is an AP view of the pelvis right here on my right, and these lines that are outlined in different colors are extremely important because the green line here is tracing the iliopectineal line. This represents the anterior column of the acetabulum. Okay, so obviously on a plain film, when this line is disrupted, you know that you have an anterior column acetabular fracture. That's the iliopectineal line. This blue line here is the ilioischial line. Okay, this is the ilioischial line, and it represents the posterior column of the acetabulum. When that is disrupted, you have a posterior column acetabular fracture. And now this yellow and purple line here are the walls of the acetabulum. So these here were the columns, but this is the wall. So the yellow line is the anterior wall of the acetabulum. The purple line is the posterior wall of the acetabulum. Notice that the anterior wall, or the yellow line, inserts more medially along the acetabular rim than the posterior wall. When that does not occur, when the posterior wall inserts more medially, we call that acetabular retroversion. Okay, and that can be associated with other pathologies such as, femoral acetabular impingement. But normally the normal appearance is for the anterior wall to insert more medially on the acetabular rim. Okay, so those are important structures when we're talking about acetabular fractures: the anterior and posterior column and the anterior and posterior walls of the acetabulum. Okay, and obviously this is the pubic symphysis here. You always look for diastasis of the pubic symphysis. If there's more than a centimeter diastasis, that's abnormal. This O here is outlining a space which is called the obturator foramen. That's important when we discuss acetabular fractures, because if there's a fracture that extends to the obturator foramen, that has implications for classifying acetabular fractures. And obviously the obturator foramen is bounded here by the superior and inferior pubic ramus and the pubic symphysis. So when we have fractures that involve the pubic rami and extend to this obturator foramen, that will have important implications. Okay, so this is what the acetabulum looks like on FOSS, okay, when we're looking at it from a lateral view, okay? And this is very important because acetabular fractures are classified based on their appearance when you're looking at the acetabulum en face, exactly like you're looking at it at this image right here. Okay, so what I want to highlight is that the green color represents the anterior column of the acetabulum. Okay, the anterior column. It involves the anterior aspect of the inferior pubic ramus, the superior pubic ramus here, the acetabular wall, which is the anterior cup here. Okay, and then also a large amount of the iliac bone, or the iliac wing right here. Okay, the blue component right here is the posterior column of the acetabulum. Notice that the posterior column is much smaller than the anterior column. Okay, the posterior column starts out here posteriorly along the ischiopubic ramus, involves the ischial tuberosity, then extends to the posterior wall of the acetabulum, the posterior cup of the acetabulum, and then extends just slightly superiorly into the posterior iliac bone. Okay, so again, this is much smaller than the anterior column here. Okay, the anterior wall is right here along the anterior acetabular cup, and the posterior wall is right here along the posterior acetabular cup. This red structure here is an important structure. It's known as a sciatic buttress. It's what essentially connects the acetabulum and the distal appendicular skeleton to the axial skeleton through the posterior aspect of the sacroiliac joint. Okay, so it's an important stabilizing structure, the sciatic buttress. But notice also that the acetabulum, when viewed en face, resembles the letter lambda, the Greek letter lambda, with the longer limb representing the anterior column and the smaller limb representing the posterior column. Okay, and again, this is the obturator foramen. This hole here is the obturator foramen. Okay, so that's the acetabular anatomy, and that's the anatomy that we look at when we classify acetabular fractures. Okay, so on a CT scan, where this arrowhead here represents the anterior wall. This is the anterior acetabular rim right here. This is the anterior wall. The arrow here is the posterior acetabular wall. Okay, so you can imagine that anything, if you were to cut the femoral heads in half, the anterior half here represents the anterior column, and the posterior half here represents the posterior column of the acetabulum. Okay, when you're evaluating for fractures, initially we often get plain films in the setting of trauma, and we typically get an AP radiograph as well as bilateral Judet views, which are oblique views of the pelvis, 45 degrees oblique to the AP views, and those are important for characterizing acetabular fractures. But in reality, a lot of times we go to the CT to fully delineate the acetabular fractures, and we use 3D reconstructions to really evaluate exactly where the fracture planes are going and for surgical management. Now I want to talk about the 5 most common types of acetabular fractures. Obviously, according to the Judet-Lehter-Nell classification, there's actually 10 types of acetabular fractures that have been classified. However, in practice, 85 to 90% of acetabular fractures that you will see in practice are these 5 acetabular fractures, and that's what I'm going to discuss in my lecture today. Because if you mastered these 5 acetabular fractures, you can essentially diagnose 85 to 90% of acetabular fractures that you see in clinical practice. So I'm going to focus on these 5 today. And these are the both column type fracture, the T-shaped fracture, the transverse fracture, the transverse with posterior wall fracture, and the isolated posterior wall fracture. Okay, so these are the 5 that we're going to discuss today. And the nomenclature is somewhat confusing, and I'll explain why. The reason why it's confusing is that these fractures, again, are classified based on their appearance of the fracture plane when you're looking at the acetabulum en face from a lateral view. Okay, so that's why, a T-shaped fracture looks like a T when we look at the acetabulum en face laterally. Okay, so that's how we're describing these fractures, or that's how the Judet-Lehter-Nell classification describes these fractures. So I want to briefly discuss an algorithm that I borrowed from some of the authors in AJR who I'll cite at the end of this lecture. And this is a beautiful algorithm describing exactly how we evaluate acetabular fractures. The first thing you're going to do, and we're going to come back to this algorithm over and over again throughout this lecture. The first thing you do is you identify, is there an acetabular fracture? There has to be an acetabular fracture for you to use this algorithm. Okay, once you've identified that there's an acetabular fracture, you're going to look at the obturator ring. Is that obturator ring disrupted? Are there superior and inferior pubic rami fractures extending to that obturator ring? Because if there is, then it's either a both column type fracture or a T-shaped fracture. And the way you differentiate those 2 fractures is if the fracture extends to the iliac wing. Because if the fracture involves the obturator foramen and extends to the iliac wing, it's a both column type fracture. If it disrupts the obturator ring and it does not go to the iliac wing, then it's a T-shaped fracture. Okay, it's a T-shaped fracture. Coming back to the algorithm, if there's obturator ring disruption, if there's not obturator ring disruption, then you assess if there's ilioischial and iliopectineal line disruption. If the answer, and that obviously means, is the anterior column and the posterior column disrupted, right? If they're both disrupted, then it's either going to be a transverse fracture with a posterior wall fracture or just a transverse fracture. And the way you differentiate that is on a CTE or a plain film, you look to see if the posterior wall is disrupted. If it is, it's a transverse plus posterior wall fracture. If it's not, it's a transverse fracture. If there's no obturator ring disruption, and there's no disruption of the anterior posterior column, or no disruption of the ilioischial and iliopectineal lines, and there's simply a posterior wall fracture, the diagnosis will be an isolated posterior wall fracture. I want to pause a little bit and just clarify a couple entities and explain also again why the nomenclature is a little confusing here. So I want everyone to understand that although this is called a both column type fracture, it's not the only type of fracture that involves both the anterior and posterior column of the acetabulum. In fact, 4 of these 5 fractures here involve both the anterior and posterior column. A both column type fracture, a T-shaped fracture, a transverse and posterior wall fracture, and a transverse fracture all disrupt the anterior and posterior column of the acetabulum. It's only the isolated posterior wall fracture that does not disrupt both the anterior and posterior column of the acetabulum. That's why the nomenclature is a bit confusing. Again, remember, it's based on its appearance when you're looking at the acetabulum on FOSS from a lateral view. Okay, so this algorithm is very important when we're looking and classifying acetabular fractures. Again, the ilioischial and iliopectineal line are disrupted in 4 of these type of fractures, right? But you really have to use the algorithm sequentially to come to these 5 different diagnoses. Okay, so let's talk about the imaging characteristics of these 5 types of acetabular fractures. So a both column type fracture, by definition, is obviously going to involve the anterior and the posterior column, but so do 3 other fractures. So that's not the only thing you can use to get to a both column type fracture. Again, it's going to disrupt the obturator ring, and it's going to extend to the iliac wing based on our algorithm. Okay, and a key feature that's seen only in both column type fractures is that the fracture plane at the level of the acetabular roof is in the coronal plane. And I'm going to explain to you what that means, or show you what that looks like. This is just a cartoon of the acetabulum on FOSS showing what a both column type fracture looks like. Notice that it disrupts the anterior column and the posterior column. It disrupts the obturator ring. You have fractures along the superior and inferior rami extending and breaking the obturator foramen. And the fracture is going through the iliac wing. So this is a classic both column type of fracture. Okay, on a plain film, you're going to have disruption of the iliopectineal ilioischial lines. Okay, because there's an anterior and a posterior column fracture. You're going to have rami fractures that extend to the obturator frame, and it may be hard to see on a plain film. Okay, and you're going to fracture that goes to the iliac bone or the iliac wing. All diagnostic of a both column type fracture. On a plain film, this is the key here. So at the level of the acetabular roof, which is a couple slices right above the femoroacetabular joint space, the fracture plane is going to go in the coronal plane, which means on an axial view it's going to extend medially to laterally, just like this. This is a fracture going in the coronal plane. That is seen only in both column type fractures, okay? So when you see that appearance, that's a both column type fracture. And you can see here on the sagittal view that the fracture is extending to the iliac wing here, okay? So this is a both column type fracture, okay? A T-shaped fracture kind of looks like a T on the lateral view when we look at it on FOSS. It's the same thing as a transverse fracture, which we'll get to in a second, but it disrupts the obturator ring. Remember, the first question we ask is, does it disrupt the obturator ring? And it does. So there will be rami fractures that extend to the obturator foramen. However, there will not be extension of that fracture into the iliac wing, because if there was, that would be a both column type fracture. But there's no disruption of the iliac wing, okay? It also involves the anterior and posterior column by definition. But the key here is for a T-shaped fracture and a transverse fracture for that matter, the orientation of the fracture line is in a sagittal oblique orientation at the acetabular roof, at the level of the acetabular roof. So again, this is what a T-shaped fracture, notice that it looks like a T, right? The fracture, when you're looking at the acetabulum on FOSS, it involves the anterior and the posterior column, and it disrupts the obturator foramen. Okay. Notice that none of the fracture plane is extending into the iliac bone, because if it did, that would be a both column type fracture. On a plain film, again, you're going to have disruption of the iliopectineal and ilioischial lines, right? Because the anterior and the posterior column are disrupted. You're going to have rami fractures that go to the obturator foramen, but you're not going to have any fracture involving the iliac wing here. Okay. No fractures involving the iliac wing. This is a T-shaped fracture. Okay. at the level of the acetabular roof, a couple slices right before the femoroacetabular joint space. Okay, the fracture plane is extend along the sagittal oblique plane, meaning it starts laterally and runs obliquely and extends inferior medially, just like this. Okay, it didn't go medial laterally like in the coronal plane. It's going sagittal obliquely. Superior lateral to inferior medially. Okay, that's a sagittal oblique. That's seen in T-shaped fractures and transverse type fractures. Okay, so that's another clue that what the type of fracture it is. Okay, so we've discussed now the two types of fractures. We've talked about, if it disrupts the obturator ring, you're going to ask yourself, does it go to the iliac wing? Because if it does, it's a both column. If it doesn't, it's a T-shape. Now, let's say the obturator ring is not disrupted. There's not pubic rami fractures that are extending to the obturator foramen. Then you're going to ask yourself, well, is the ilioischial and iliopectineal line disrupted? Or is the anterior and posterior column disrupted? Because if they both are, it could be a transverse fracture or a transverse plus posterior wall fracture. Okay. So a transverse fracture, again, involves the anterior and posterior column, but there's no obturator ring disruption. There remains, the fracture plane is in the sagittal oblique orientation on a CT, okay? So it's just like a T-shaped fracture, but there's no obturator ring disruption, okay? That's what a transverse fracture looks like. It looks exactly like this. It involves the anterior and the posterior column, but there's no obturator ring disruption, no extension to the iliac bone, okay? Again, on a plain film, you're going to have disruption of the iliopectineal, ilioischial lines. Okay, anterior and posterior column are disrupted. Okay, there's going to be no rami fractures extending to the obturator foramen. There's going to be no iliac bone fracture here. Okay. Again, this is sort of a subtle appearance of the fracture extending in the sagittal oblique orientation, starting superior laterally, extending inferior medially. Okay, so this is either a transverse or a T-shaped fracture, depending on if the obturator foramen is disrupted. In that case, it was a transverse fracture. Let's talk about a transverse fracture with a posterior wall fracture. As you can imagine, it will be the same thing as a transverse fracture, but with a posterior wall fracture as well. So again, there will be no obturator ring disruption. There will be disruption of the ilioischial and iliopectineal lines, and the posterior wall will be fractured as well. Okay, so that's what we're going to see here. This is what it looks like, the cartoon, based on the lateral view on FOSS. It involves the anterior and the posterior column. The posterior wall here has been displaced posteriorly, but the obturator ring is intact, and there's no extension of the fracture into the iliac bone. So this is a transverse plus posterior wall fracture. Again, on a plain film, you're going to see disruption of the iliopectineal and ilioischial lines, which are a little bit difficult to appreciate on this view. There are no rami fractures extending to the obturator foramen, but the posterior wall here, you can see it's been displaced. It's been displaced here, okay? So this is a transverse plus posterior wall fracture. You can see it better on a CT because, again, you can see the fracture in the sagittal oblique plane. So you know that this is either a transverse or T-shaped fracture, but there's displacement of this posterior wall. So this is actually a transverse plus posterior wall fracture, provided that there are no rami fractures extending into the obturator foramen. Excuse me, which there were not in this case. Okay, so this is a transverse plus posterior wall fracture. The last fracture I want to talk about today is an isolated posterior wall fracture, which is, by the way, the most common type of acetabular fracture that you're going to experience in your clinical practice. An isolated posterior wall fracture is the most common of these fractures. So the obturator ring will not be disrupted. There will be no involvement of the anterior posterior column. The ilioischial and iliopectineal lines will be maintained, but there will just simply be an isolated posterior wall fracture that you'll see on plain film and CT. Okay, so again, on a CT, on an axial view, if a fracture is going this way, that's an anterior wall fracture. There are, by the way, isolated anterior wall fractures. That's one of the type of fractures that you can see based on the Judet-Letter-Null classification, but they're not as common as the most common posterior wall fracture, which will be a fracture running right here in this red, just like it is in this red arrow. Okay, so oblique type fractures involving the posterior wall, and this is what it looks. This is a cartoon of a displaced posterior wall fracture. Notice that there's no involvement of the anterior column, no disruption of the obturator ring, no involvement of the iliac bone. Okay, on a plain film, you're going to see, disruption of this posterior wall. It typically can be displaced. Okay, and on a CT, you'll see a posterior wall fracture that's typically displaced posteriorly, just as in this case. It should be right here, but it's been displaced posteriorly. Okay, so this is an isolated posterior wall fracture. Okay, so those are the 5 most common types of acetabular fractures. I want to come back to these questions that we posed at the beginning of the lecture. So disruption of the ilioischial line indicates a fracture of what? Okay, so the ilioischial line, again, remember, represents the posterior column on a plain film. So that would be disruption of the posterior column, D. And the iliopectineal line represents the anterior column, remember? So the answer here is D. Question 2, we're showing an axial CT image through the level of the hips, and notice here, this is the posterior wall. It's been displaced posteriorly, so this is an isolated posterior wall fracture, which is the most common type of acetabular fracture that you're going to see. So again, the answer here is B. This is a posterior acetabular wall fracture, the most common type of acetabular fracture that you will experience in your clinical practice. Okay, question 3 deals with the algorithm that I showed you. So the primary distinguishing feature between a both column fracture and a T-shaped fracture is what? Okay, so both of these type of fractures will disrupt the obturator ring. So it can't be that. It can't be B. They both involve the anterior and posterior columns, so they both disrupt the iliopectineal and ilioischial lines. So the answer is not C. It's not an isolated posterior wall fracture, but the answer is A, because when the fracture extends to the iliac wing, that is indicative of both column fracture. That is not something that we see with a T-shaped fracture. So the answer here is A, based on our algorithm. This is question 4. I'm showing you a CT image through the acetabular roof. Notice that the fracture along the left is going in the coronal plane, extending medially to laterally. Okay, this is indicative of a both column type fracture. Remember, the both column type fracture involves a fracture in the coronal plane at the level of the acetabular roof. Okay, so the answer here is a column type fracture, or C. Right? A transverse type fracture or a T-shaped fracture has the fracture going in the sagittal oblique plane. Okay. And then finally, the last question I wanted to ask was, a fracture going in the sagittal oblique plane is indicative of what type of fracture? Well, that would be the transverse fracture, right? Had I put a T-shaped fracture here, that would have also been an acceptable answer. But a column fracture, again, goes in the coronal plane. So the answer here is B. The sagittal oblique plane is typical of transverse fractures. Okay, so I hope what we've done here today is discuss and understand basic acetabular anatomy, remembering that the acetabulum, when you look at it on FOSS, represents the Greek letter lambda. The anterior column is much bigger than the posterior column. We talked about the 5 most common type of acetabular fractures, which include the both column type fracture, the T-shaped fracture, the transverse with posterior wall, and the isolated posterior wall fracture. We developed an algorithm to classify those 5 most common type of acetabular fractures, which is very important when you're evaluating acetabular fracture. Then we talked about the imaging characteristics that delineate and differentiate the types of acetabular fractures, knowing that a fracture that goes in the coronal plane at the acetabular roof is indicative of a both column type fracture, but a fracture that goes in the sagittal oblique plane on CT is more indicative of a transverse or a T-shaped fracture. Okay, this is a reference. So that algorithm that I produce here is not my work. It's the work of these great musculoskeletal radiologists that they published this in AJR back in 2006. You can read this article. This article is excellent. So please take a look at that article. And thank you so much for your attention. Please email me if you have any questions. Thank you.